Did you know that 1 in 1,000 babies born in the UK has a permanent hearing loss in both ears? That's approximately 3 babies born per day who could benefit from using hearing aids. Hearing is important for many aspects of development, including speech and language, communication, learning and social interaction. So how do we know a baby has a hearing loss? Every baby has their hearing checked, usually within the first few days of life. If needed, the baby is then referred to a hearing specialist, also known as an audiologist. Audiologists can measure hearing and diagnose hearing loss whilst a baby is asleep, using a specialist test which measures how the brain responds to different pitches and levels of sound. Hearing aids can be programmed using these results. Did you know that on average a baby is only 82 days old when hearing aids are first fitted? It is crucial for babies to be able to hear in order to help them develop. Hearing ability can change, so families will see an audiologist regularly to check the baby's hearing and hearing aids. At the moment, families have to wait until a baby is 7 to 9 months old for the next hearing test that is currently available. This is a wait of at least 4 months and can cause some anxiety for some parents. So where do the research team in Manchester come in? We are developing a new test to check that babies between the age of 3 and 7 months are able to hear a range of speech sounds when wearing their hearing aids. The test we are performing involves measuring how well the baby's brain responds to these speech sounds whilst wearing their hearing aids. This test is different to the first one they have because the baby has to be wearing their hearing aids and has to be awake. We travel around Britain in our specially adapted hearing van to perform testing close to families' homes. We are hoping that this test can be used in audiology departments in the future to provide more information about the benefit of hearing aids. We want to say thank you to the families who have already participated, the audiology departments who are helping identify babies for the study, and also our supporters, the NIHR, the Marston Family Foundation and the Otiscombe Foundation. My name is Caroline Hudson and I'm a research audiologist at the University of Manchester.